So when does HIV become an AIDS diagnosis? Well, pretty much when your CD4 count drops to 200 or less and you have an opportunistic infection, those two go together, you are now classified and diagnosed with AIDS. So an opportunistic infection and a CD4 count below 200 or less. So opportunistic infections, a lot of them, they can happen. You can get one of these diseases before your CD4 count drops to 200. You can be treated for it. It can go away. So it all depends on the patient and the disease that they acquire. But this is basically your diagnosis. Here are a list of opportunistic diseases. Some of these look pretty similar. Familiar, tuberculosis, toxoplasmosis of the brain, wasting syndrome, encephalopathy, cryptococcus, candidiasis, a lot of infections. So the first sign of HIV and the first sign of diagnosis of AIDS may be a patient that already has a CD4 count very low, or the first time you know you have HIV is you develop thrush, oral candida in the mouth. So that may be one of the first clinical findings of being HIV positive. Treatment for candida, remember, is nystatin. It's a swish and swallow. You can also take oral diflucan or Mycalextros's lozenges for that. Candidiasis is an opportunistic infection. These patients have difficulty swallowing. It's painful to swallow. They don't have an appetite with this. So right there, the patient may not want to eat. A very common one out there used to be called Pneumocystis carinii pneumonia, PCP. It's a fungus. The new name is Pneumocystis jirovecii. Side effects of this one, it's common: short of breath, fever, night sweats, fatigue, weight loss. That sounds like tuberculosis, but it's not. It's a fungus. Here's your medications for those. Notice if you're taking the Septrum, no dairy products 2 hours before or 1 hour after the medication. Toxoplasmosis gondii is a parasite that comes from the cats as well. Cats don't have it, but they can bring it in from the outside. Also uncooked meat, raw rare steak, pork. This one invades the brain, so it causes memory loss, vision loss, seizures. The medication for that is spiromycin that causes a rash for itself. Another one, this one was very common when AIDS first came out, Kaposi sarcoma. This is treated with cryotherapy, interferon chemotherapy. It's on the skin on the outside, but Kaposi also can be on the inside in your lungs and intestines, skin, mouth. It's a horrible looking one. Cytomegalovirus, a very common. This is transmitted through sex, saliva, close contact. You lose your vision, peripheral vision with this. So medication for cytomegalovirus is ganciclovir. You have to handle this medication like chemotherapy. Very potent medication. Histoplasmosis is a fungus found in soil, bird, bat droppings. So people with HIV, or if they've got a low CD4, should not be doing yard work. It's found in the soil. So side effects of that: fever, weight loss. Cryptosporidiosis. It's a parasite found in animal and human feces. These are the people that get this crypto when they go swimming in lakes and streams or swimming pools. This could be in there. This causes watery diarrhea, cramping, nausea, and vomiting. So if they're taking meds that are causing these symptoms already, they're just going to have more of it. So patients shouldn't be drinking from streams or lakes. They should only be drinking bottled water with that's been filtered, bottled water bottled, or their own filtered with sub-micron filters. Patients shouldn't be eating raw oysters, shouldn't be eating sushi. Lymphomas, obviously, if you get a lymphoma, you're going to have chemotherapy. There's one out there called HIV wasting syndrome. You basically lose 10% of your body weight combined with diarrhea, loss of appetite. Treatment, hopefully, is get the patient to eat. So Marinol or Megace to boost their diet, or at least their hunger. Patients, basically, this you could call this HIV failure to thrive, but this is a specific HIV wasting syndrome. Here's another one, a fungus that's common in the dirt and the dust from southwestern U.S. If you get this one, coccidioidomycosis, that was a poor pronunciation, sorry about that. You have to have lifetime treatment for this. If it's contracted in your HIV, lifetime treatment, because it'll keep coming back. So, dirt and dust. You could be on a trip to the southwest. You go down to Albuquerque to go to the balloon festival. Dust storm comes up. You're HIV positive. Just from dust, a dust storm could have this fungus. You could acquire this. Now, normally, you have a good immune system. Don't have HIV. Our body takes care of this. There's another one out there called AIDS dementia complex. These are the different themes that fall under that category in the DSM. A lot of different diagnoses fall under the AIDS dementia. So what about you as a nurse? If you are an RN and been stuck with a contaminated needle, what do you do? What happens for the nurse? What's going to take place? Well, currently now, if you are stuck and you think you might be HIV, we have something called post-exposure prophylaxis, PEP, PEP. PEP consists of 2 to 3 antiretroviral medications that should be taken for 28 days. And if you've been exposed, this will basically knock out your HIV virus because you are taking care of it before it even gets going. Since the beginning of HIV, according to the CDC, there's only been 57 healthcare workers have been documented as seroconverting to HIV positive as a result of work exposure. That's pretty low in almost 30 years of HIV out there. If you are a healthcare worker and you get exposed working at a hospital, you pretty much will be under confidential testing because that's where you work. So it's pretty difficult to get HIV with a needle. So healthcare institutions, here are things that take place out there. So if you work in a small country, rural little clinic and word gets out that you're HIV infected, the doctor may lose their clientele. Hopefully it's not happening anymore, but there are insurance companies that would increase your insurance rate or cancel you. They may change your workload. So what do you have to do, or what can you do because of those things? Different ideas.